Hey, manual therapy friends, it's Dr. David here, and we're on talking about what techniques can be done to help out sciatica problems. So this is your manual therapy Thursday today, and what we're going to be discussing specifically is SI joints mobilizations. Now, a lot of people, there's controversy in this. A lot of people don't think the SI joint moves. They think that it shouldn't even be touched, that there's no point in touching it because it's like virtually a fused joint. I used to believe that a long time ago. I actually did staunchly believe that until I saw that it actually did move. I felt it, and I saw the improvements that patients have when it's treated properly. So I can't deny the improvements in patients, sensations, back pain, all that stuff. So I'm going to do that. I don't want our patients to end up with some unnecessary back surgery or be taking pain medications or injections if there's a hands-on technique that can free up that joint that's causing them a bunch of problems. So let's get into the technique here. One of the requirements here is that you know where the SI joint is. That's challenging. It really is. Just finding the SI joint can be a big difficulty. So use landmarks, of course. You're going to use the PSIS. Now, one thing to note is the PSIS is a pretty big structure, and an SI joint is a pretty big structure. It's usually like 1.5 to 2 inches long vertically, a little diagonal, but mostly vertical on either side of the tailbone. So you have to kind of palpate different edges of the bone. And you can use a skeleton for a reference point. I'm sure all of you guys have one in the clinic. So of course you can trace the iliac crest. I'm on the iliac crest here, and just go back until you're on the PSIS right there. Now I like to do this little test here to feel motion at the SI joint. It's called we call it the flick test. And you can do it on both sides, of course. So that's just a way to confirm that you're on the SI joint. But if you're just medial to the PSIS, you're on it. Just realize that it's a long joint. It's not just a little facet joint like you see in the rest of the spine. So if you know that an SI joint is stuck, then 9 times out of 10 you can mobilize it just like I'm going to show you and increase the mobility and have a dramatic improvement in the patient's symptoms. If you can feel the mobility, if you're a little more advanced in your skill set, and you can do a test like this and judge which one is stiff and which one is not, then you can be a lot more specific in going through this. You can get a much quicker outcome. But let's assume that you're not. Let's assume that you're just trying to get into manual therapy and learning some techniques. Then what I would do if I were you is begin to just gently mobilize P to A, posterior to anterior. So his PSIS is right here. I'm just medial to it, and I'm going to drive force anteriorly using my hypothenar eminence here. And then I like to just put my other hand over and lean onto it. And then you're just doing grade 1, 2, 3, 4, and you would need to check with the patient beforehand, especially if they're a little older and have some bladder issues. Just make sure that their bladder's not too full, and give them a chance to go to the bathroom if they need to before this, because you're smashing all that. And then you just lean over it. It's the P to A mobilization. Now, where you can get a little more specific is because it's a long joint, you just move down 1/2 inch or so. Now, when you push on the top half of the joint, you're likely creating nutation or flexion in the sacrum, and when you're pushing on the bottom half of the joint, you're likely creating counternutation or extension. So you might consider that if it's something that you are looking at. Now, the way that I'm doing this is I'm on the right side of the patient, which means for me personally, I have the best leverage to push on the left SI joint. If I need to push on the right SI joint, I need to go around and get in position on the other side. It just hasn't worked out for me. Maybe it'll work out for you, but I experiment and try. If I try pushing on his right SI joint from here, I just don't get the same leverage. I think for me it's because I can't get away from also pushing on the PSIS, but if I'm right here, this PSIS is off my hand, I'm on the sacrum only, so I can move the sacrum a lot better. I'm more effective this way. And if I go over here, I'm not really pushing completely on the sacrum. I'm just on the lateral side of it, but I'm also on the PSIS out here. So really simple technique, but very powerful. I would hang out on each of those SI joints if I found some stiffness or some problem down there for a few minutes total, and usually it can create some massive relief in patients, especially if they tell you that they've got lower back pain in the sacral area, in the SI joint area. So I hope that this Manual Therapy Thursday was helpful for you. If you're doing SI joint mobilizations, try that one out, see if that's beneficial for you. If you're kind of skeptical about the SI joint, try it out. See what patients tell you. Talk to a therapist that does SI joint techniques and see what their experience has been, and just do some more research. Now, what I've seen as far as why therapists kind of stray away from doing SI joint stuff is because it's so confusing. They don't know. There's so much questionable stuff about the SI joint and the sacrum and the way it moves and all the ligaments surrounding it and if it even moves. And so they just tend to not do anything about it. I venture to say you're missing out on helping people seriously get better. So I encourage you to experiment with the sacrum. Don't be afraid of it. Move the SI joint. This is a super easy technique, and you can begin to have some powerful effects on patients. I hope you have a great day. Comment below, please. We'll talk later. Bye-bye.